Every year, millions of older adults go in for routine health checkups, believing they're doing the right thing to stay ahead of potential problems. But what if I told you that one of these very tests, often considered harmless, could quietly raise your risk of stroke overnight? It sounds unbelievable, right? You trust your doctor, you follow every recommendation, you think you're being proactive. But hidden in the fine print of modern medicine are quiet risks no one talks about. Not the news, not your pharmacist, and sometimes not even your doctor. Imagine walking out of a checkup feeling fine, only to feel dizzy, weak, or disoriented days later. You ask yourself, what just happened? And the real answer might lie in the test you just took. Certain diagnostic scans and procedures, especially when overused or given to those with underlying conditions, can trigger sudden spikes in blood pressure, impair circulation, and create a chain reaction in the body, one that ends in a stroke. But this video isn't meant to scare you. It's here to arm you with knowledge, so you can ask smarter questions and make safer decisions. Because after the age of 60, health is no longer just about catching problems early. It's about avoiding the ones we might accidentally cause. That means choosing our tests as carefully as we choose our doctors. So in the next few minutes, we'll uncover 5 routine medical tests that could increase stroke risk in seniors and show you exactly how to protect yourself before your next appointment. If you're over 60, drop a 1 in the comments below. If not, type 0. Now let's begin with the first test that deserves your attention, the contrast CT scan. It might sound helpful, even harmless, but let's look closer at what's really going on. If you've ever had a CT scan with contrast, you probably remember that warm flush moving through your body. That's the contrast dye doing its job, making your blood vessels and organs easier to see. But for seniors, especially those with high blood pressure, heart issues, or kidney trouble, this dye can cause more than just pretty images. It can quietly strain your entire cardiovascular system. In some people, contrast dye causes a vasovagal reaction, a sudden drop in heart rate and blood pressure that can lead to dizziness, fainting, or even unconsciousness. But in others, the opposite occurs. Blood pressure rises rapidly, and delicate blood vessels spasm under pressure. In both cases, the stress response may silently push a vulnerable body towards stroke or cardiac problems within days. A major study in the Journal of Vascular and Interventional Radiology found that older adults who received contrast-enhanced CT scans had significantly higher rates of vascular complications within 72 hours, especially those with high blood pressure, heart disease, or kidney dysfunction. These people didn't show symptoms right away, but the effects showed up shortly after the scan, often without warning. One real case involved an 81-year-old man who had a routine CT scan for mild digestive issues. The scan came back normal and he went home feeling fine. But 2 days later, he suffered a minor stroke. Doctors suspect the contrast dye spiked his blood pressure, leading to a clot that blocked blood flow in his brain. He survived, but it changed the way his family viewed routine testing forever. Let's be clear, CT scans with contrast aren't bad. They're life-saving in many cases, but they should be used wisely, not just in case. If your doctor suggests one, ask, is this truly necessary? And is there a safer alternative for someone my age and health profile? You might be surprised to learn that a non-contrast scan or an ultrasound could provide the answers without the added risk. Next up is the stress test, also called the treadmill test. On paper, it sounds smart. Hook up a heart monitor, walk or jog, and track your heart's performance. But for people over 60, especially with high blood pressure or cardiovascular conditions, this routine test may be far more stressful than it appears. Here's why. As the test ramps up, your heart rate and blood pressure spike. This is intentional to simulate physical exertion. But in older adults with vulnerable arteries or past heart trouble, the sudden stress can trigger arrhythmias, blood pressure surges, or even minor tears in fragile vessels, some of which lead straight to the brain. A 2020 study in the American Journal of Cardiology followed more than 1,300 patients over age 65 during treadmill stress tests. The results were eye-opening. Nearly 7% experienced complications during or just after the test, including abnormal heart rhythms and spikes in blood pressure. The most affected? People who already had vascular problems going in. Take Margaret, a 74-year-old from Ohio. Her doctor ordered a stress test just to be thorough. Halfway through walking on the treadmill, she felt dizzy and had chest tightness. They stopped the test immediately, but the next day, she suffered a mild stroke. Doctors believe the sudden spike in her blood pressure may have ruptured a tiny vessel in her brain. To be fair, the test itself didn't cause the stroke, but it stressed an already fragile system. So what can you do? Ask your doctor, is this the safest way to check my heart? If you aren't having chest pain, shortness of breath, or fatigue, a full treadmill test might not be needed. Less intense alternatives might be better suited to your body's current condition. There are options. A nuclear stress test uses medication to mimic the effects of exercise without putting your body through physical strain. A resting echocardiogram provides valuable insight into heart function while your body is at ease. These tests are especially helpful for older patients or those who can't tolerate vigorous activity. Don't hesitate to ask, what are we trying to find? And is there a gentler way to do it? If you're symptom-free, sometimes waiting or using a different method can offer the same clarity with much less risk. Your age and health history matter. Don't let testing be one size fits all. Speak up, ask questions, and protect yourself wisely. Let's move on to another test that feels routine. But for older adults, it can quietly carry more risk than expected. We're talking about the endoscopy. Whether it's for your stomach, colon, or esophagus, doctors often suggest it just to be safe. But if sedation is involved and you're over 60, the risk-benefit balance becomes more delicate. Here's the concern. Most seniors take some kind of blood thinner, aspirin, warfarin, Plavix. Add sedation into the mix and you've got a scenario where blood pressure dips, circulation shifts, and clotting ability changes. That's when something as small as a change in blood flow could set the stage for a mini stroke or internal bleeding. In 2021, a comprehensive review in the journal Gastrointestinal Endoscopy found that sedated endoscopy procedures in adults over 65 were followed by a higher rate of transient ischemic attacks, also called mini strokes, within 72 hours. They weren't full-blown strokes, but they were clear warnings that something went wrong in brain circulation. Consider the case of a 76-year-old woman who underwent a colonoscopy with sedation. She was healthy going in, no symptoms at all. But 2 days later, she slurred her speech and lost balance. Doctors later confirmed she had a mild stroke. Her blood pressure dropped during sedation, and combined with her aspirin use, it may have let a clot slip through. Even low-risk procedures can become problematic when age, medication, and sedation combine. This doesn't mean endoscopies are bad. It means they should only be done when clearly necessary. If your doctor says you're due, ask why. If you have no symptoms, it's worth questioning whether the timing and method are truly appropriate. Before agreeing, tell your doctor every medication you're on. Ask, will I need to stop my blood thinner? Are there safer alternatives? Can we skip sedation? Sometimes, lighter sedatives or even non-sedated endoscopy may be possible. These conversations could help you avoid complications you never saw coming. At this stage of life, tests shouldn't be automatic. They should be strategic. Your health isn't a checklist, it's a dynamic picture. Understanding how medications and procedures interact with aging bodies gives you the power to make informed, safer choices. Now, let's look at another test that seems routine, an MRI with contrast. MRIs themselves are powerful tools that can spot tumors, inflammation, or early signs of disease. But when a contrast dye is added, especially for older adults with reduced kidney function, the risk may quietly rise without anyone realizing it. The contrast dye often contains a heavy metal called gadolinium. Normally, the kidneys flush it out. But after 60, kidney function naturally slows, and many people have mild or undiagnosed kidney disease. If your kidneys don't eliminate the gadolinium properly, traces may linger in the body, potentially causing long-term effects. One of the rare but serious complications linked to gadolinium retention is nephrogenic systemic fibrosis, NSF. This condition causes thickening of the skin and connective tissues, making it hard to move or breathe, and in severe cases, affecting internal organs. While rare, it's more likely if kidney issues are present. But here's something even fewer people know. Retained gadolinium has also been found in brain tissue. And while not fully understood, early research suggests it might contribute to symptoms like brain fog, dizziness, and disorientation, especially in people already at risk for circulatory or neurological problems. In 2019, a study published in Radiology tracked over 2,000 patients over the age of 65 who received MRIs with contrast. Within a week, 5% experienced stroke-like symptoms: headaches, blurred vision, balance issues. They weren't major strokes, but they were warning signs, especially in those with kidney problems. Take Harold, a 79-year-old veteran who had back pain and was sent for an MRI with contrast. He didn't know his kidneys were already in stage 3 decline. 2 days later, he felt weak, confused, and lightheaded, signs of gadolinium retention. A simple kidney test beforehand could have flagged the risk. So what should you do? Ask your doctor, can we do the MRI without contrast? Often, the answer is yes. And if contrast is necessary, request a kidney function test, a GFR blood test, before the scan. It's fast, simple, and gives both you and your doctor the insight to proceed safely. Also, let your doctor know if you've ever had strange reactions to imaging in the past. The MRI machine isn't the danger. It's the extra chemicals your body might not process well. With age, personalized precautions are the key to avoiding silent complications later.